Welcome to Zero Fat TV Think Different, where we explore issues that matter, challenge the status quo, and inspire change. Today, we're diving into a crucial topic: the decline in hospital safety and the question we all need to ask: who is to blame?
The growing crisis in hospital safety. Hospital safety is a cornerstone of quality healthcare, but recent reports have revealed alarming lapses in patient care worldwide. From staffing shortages to outdated equipment, hospitals are struggling to maintain the standards that patients deserve. In fact, healthcare watchdogs have reported an increase in preventable errors, raising concerns about whether hospitals are truly safe havens for recovery. This decline isn't isolated to one region or country. It's a global issue. Patients are finding themselves caught in a healthcare system where safety protocols are stretched thin, creating an environment ripe for mistakes. But why is this happening? And more importantly, who is responsible for addressing it? Staffing shortages. The root of the problem? One of the leading causes of hospital safety issues is the ongoing staffing crisis. Overworked, understaffed, and burned-out healthcare workers are more prone to errors, and patients are paying the price. For instance, studies show that patients in understaffed hospitals are at a higher risk of complications such as infections or medication errors. The COVID-19 pandemic exacerbated this issue as many healthcare workers left the field due to extreme stress and inadequate support. Even as the pandemic eased, hospitals have struggled to fill these gaps, leaving patient care in jeopardy. But staffing is just one piece of the puzzle. Systemic issues also play a significant role. Corporate greed and budget cuts. Another factor contributing to the decline in hospital safety is the prioritization of profits over patient care. Corporate ownership of hospitals has led to cost-cutting measures that directly impact safety, such as reducing essential staff, delaying equipment upgrades, and cutting corners on training programs. Mission Hospital in Asheville, North Carolina, serves as a prime example. Since being acquired by HCA Healthcare, the hospital has faced multiple safety violations, including an immediate jeopardy recommendation. This highlights how corporate decisions often put financial gain ahead of patient safety, creating a dangerous environment for everyone involved. The role of leadership and accountability. Hospital leadership also bears responsibility for the current crisis. Leaders are tasked with ensuring that safety protocols are followed, staff members are supported, and patients receive the highest quality care. However, many hospitals lack transparency and accountability when incidents occur. Additionally, inadequate oversight by government and accreditation bodies has allowed some hospitals to operate with minimal consequences for safety violations. Without stronger policies and leadership accountability, these issues will continue to grow, leaving patients at risk. So, where do we go from here? Solutions. What can be done to fix hospital safety? Addressing this crisis requires a multifaceted approach. First, governments and hospital administrations need to invest in recruiting, training, and retaining healthcare workers. Better staffing ratios can alleviate burnout and reduce errors, ensuring better patient outcomes. Second, hospital leadership must prioritize safety over profits by allocating resources to improve infrastructure, update technology, and maintain proper protocols. Finally, stronger oversight and public awareness are necessary to hold healthcare institutions accountable for lapses in safety. By working together, we can restore faith in our hospitals and create a safer environment for all. The decline of hospital safety is a complex issue rooted in staffing shortages, corporate greed, and weak accountability. Overworked and understaffed healthcare workers, combined with profit-driven decisions, have created a dangerous environment for patients. Leadership failures and inadequate oversight further exacerbate the problem. However, solutions are within reach. By addressing staffing issues, promoting accountability, and prioritizing safety over profits, hospitals can regain the trust of their patients. At Zero Fat TV Think Different, we believe this is a conversation worth having, because healthcare should never be a gamble. Don't forget to like, subscribe, and share your thoughts in the comments. Let's keep this important conversation going.
Thanks for watching. Zero Fat TV. I can and I will. Benny B. PCE.